Ladies and gentlemen, please take your seats. Our program will begin shortly.
Iowa.
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 So my question is,
Ladies and gentlemen, welcome to the AARP Des Moines Register Presidential Candidate Forum Series. AARP is a nonpartisan organization dedicated to enhancing the life for all as we age. The Des Moines Register is Iowa's largest news organization, reaching Iowans across the state. Now, please welcome to the stage our forum moderators, Des Moines Register opinion editor Kathy Obradovich and Radio Iowa's news director O.K. Henderson.
I'm going to stand at the corner of the stage.
Please welcome to the stage former United States Congressman and current United States Senator from Vermont, Bernie Sanders.
Great to see you. Senator, you're our senator. Okay. Senator, your question is coming from the audience, and it's right here in front of you.
My name is Bill Grove. Too many older adults are struggling to afford their life-saving prescription drugs. My prescription drug costs have doubled in the last few years. Fortunately, that increase has been manageable for me, but that is not the case for many other older Iowans. Too many make tough choices like filling a prescription or buying food for the week. If elected, what is your plan to make sure Americans have access to affordable prescription drugs?
Bill, thank you very much for that question. You know, in Washington, D.C., there are a lot of selfish, greedy, dishonest entities. But I have had a hard time figuring out whether it is the pharmaceutical industry or Wall Street, which is the worst. Not quite clear, but I think it may well be the drug companies. All right, and let me tell you why, Bill. Last year, the top 10 drug companies made $69 billion in profit. How's that? Not bad, $69 billion in profit, while 1 out of 5 Americans cannot afford to fill the prescriptions their doctors write. Think about that. When we talk about a dysfunctional, irrational healthcare system, how insane is it that you go to the doctor because you're sick, doctor writes out a prescription, you can't afford to fill it. Well, what happens? You get sicker. You end up in the emergency room at greater cost to the system. So what do? First of all, we make it very clear to the drug companies that the day is over now, today. First day as president, they're going to stop ripping off the American people and charging us the highest prices in the world for prescription drugs. 20 years ago, 20 years ago this year, I took a busload of women who were dealing with breast cancer in northern Vermont across the Canadian border to go to Montreal and buy tamoxifen, a widely prescribed breast cancer drug. Take a guess, Bill, the differential in price between Canada and the United States for this breast cancer drug. Well, it was 10 times. And I remember, we'll never forget, women were crying. These are working class women were crying that they were now paying 1/10 of the price. In a week, I'm going from Detroit to Windsor, Ontario, with a group of people to buy insulin because they have diabetes. Once again, the differential will be 10-1. They're going to pay 1/10 the price in Ontario than they pay in Michigan and in the United States. So this is what we are going to do. First of all, under the Medicare for All proposal, which I've introduced, we do what the United Kingdom does and what other countries do. We cap the amount of money that people will spend for prescription drugs at $200. Why is that? Because when you talk about health care, you've got to talk about prescription drugs. You can't say, oh, you can go to the doctor, that's great, but we don't cover the cost of prescription drugs. Cap of $200. How do we save money? Well, we do it on prescription drugs. We do it in a variety of ways. Number one, we have Medicare negotiate prescription drug prices with the drug companies. All right. Number two, we do pretty much what Canada does right now, is you take a look at what drug prices are around the rest of the world. You take 5 or 6 countries and you say to the drug companies, guess what? You're not going to charge us any more than you do on average with these other 5 or 6 countries. Number three, what you do is right now, as a result of that trip that I took to Canada 20 years ago, other members of Congress began to do it, senators began to do it, and right now, sad to say, there are millions of people who are buying prescription drugs abroad. What we should make legal is for your pharmacists and prescription drug distributors to be able to buy FDA-approved drugs in Canada and in other countries and sell them in the United States at a fraction of the price that they are now being sold. Fourthly, guess what? Your tax dollars have gone to develop many important drugs. And the drug companies use that research and then end up making as much money as they want. When taxpayers' dollars are used for research, we're going to have reasonable pricing on the part of the drug companies. Those are some of the things. I've been dealing with the pharmaceutical industry for 20 years. I am their worst nightmare.
All right, Senator, you said earlier this week. You said earlier this week that Vice President Biden was sounding like Donald Trump and the healthcare industry when he was criticizing the Medicare for All, your healthcare plan. What did you mean by that, and what do you think is being distorted about your plan?
Well, I'll tell you, it's not just me. I think you may have noticed there are several PolitiFact groups. CNN did an article on this. Look, Joe is a friend of mine, and he has different points of view on healthcare than I do. That's great. We'll debate those issues. But we should not have distortions of what Medicare for All stands for. Joe talked about a hiatus. Was that the word that he used? In care. In other words, if you have a serious illness, as we transition to Medicare for All, there may be a hiatus. That is absolutely wrong. Of course, there will be a continuity of care. And that is what CNN and the PolitiFact media said as well, and experts said as well. So there will be no hiatus. People will obviously continue to get their care. And second of all, I think he suggested here as well that Medicare would go away, would not have Medicare. And that's wrong as well. Let me tell you what you would have. I am a strong defender of Medicare. Medicare is a very important and good and popular program for seniors. But let's be honest. Medicare does not provide all of the benefits that seniors need. Seniors need dental care. Medicare doesn't provide it. Seniors need hearing aids. Medicare does not provide it. Seniors need eyeglasses. Medicare does not provide it. Under Medicare for All, we expand those benefits to seniors. They are health care benefits, and they deserve it. Furthermore, we expand home health care. Millions of seniors who prefer to stay at home rather than go into a nursing home. They cannot afford to do that. They have to spend out everything that they've saved their lives. We fund home health care so people have the choice about staying home. So my only criticism of Joe on this one is he basically provided misinformation about what Medicare for All would do.
One of the objections to your plan, though, is that it's unrealistic to force millions of people to give up their private insurance if they like their plans. Medicare Part D, Medicare Advantage are also private insurance. What's your answer to that?
Well, let me answer it in a couple of ways. If I told you that the most you would pay in a given year for prescription drugs is $200, how does that compare to Medicare Part D? Pretty good, huh? Yes, it is. And furthermore, when we talk about the difficulty of a transition, I find that just really rather remarkable, and I really think it sells out the ability of the American people to do big things. In 1965, Lyndon Johnson in the Congress had a very radical idea. They said that we should provide a public health insurance program for people 65 or older called Medicare. Back in 1965, they did that without anywhere near the kind of technology that exists today. So if back in 1965 we could develop a brand new program and get it going within 1 year to provide health insurance for millions and millions of seniors, how does anybody think that over a 4-year period we cannot take an existing program, Medicare, and over a 4-year period provide health care to every man, woman, and child in this country? So let me tell you what we do. First year, we expand benefits to cover seniors, as I just mentioned, and we lower the eligibility age from 65 to 55. Not all that complicated, and we cover all the children. Next year, we go to 45. Then we go to 35. And then we cover every man, woman, and child in America. Let us be clear. The United States of America is the only major country on earth not to guarantee health care to all people as a right. We end up spending almost twice as much per capita on health care as do the people of any other country, and we pay by far the highest prices in the world for prescription drugs. It is time now to complete what they began in 1965. Medicare is a strong program. Let's expand it to every man, woman, and child in this country.
Senator, the Kaiser Family Foundation says about 12% of Americans in the workforce are working in the healthcare industry.
Yeah.
What happens to people who are processing payments for private pay? Where do those people go?
Well, hopefully, over a period of time, they will be transitioned into the healthcare system. And you asked a good point. When we talk about healthcare and healthcare workers, what do we want? We want people who are going to be doctors and nurses and nurse practitioners and do all the psychologists and psychiatrists, do the work that keeps people healthy or cures illnesses. That's what a healthcare worker should do. The reason we pay so much more than any other country for healthcare is we have an incredible bureaucracy, and we spend hundreds of billions of dollars a year on billing. So to be honest with you, if somebody is sitting there in an office telling you that, I'm sorry, you're not going to get covered for what you thought you would get covered, or telling a doctor you can't do this therapy or that therapy, that is not healthcare. That is denying healthcare. That is bureaucracy. That is a waste. So I want as many of those people as possible to get trained to provide healthcare to all people, not just sit around billing people. That's what we will be doing over a period of time.
One final question on this topic. As you know, some of your competitors have said if the party embraces Medicare for all, it will be a loser for the entire party in 2020.
Really? That's not the polling that I have seen. You know, I am told that everybody loves private health insurance industry. Oh, they are just so fond of Aetna and all these other major corporations. I don't believe that. I think people love their doctors, people love their nurses, people often have very good and positive experiences in hospital when they have to go there. To be honest with you, I have not talked to anybody who loves their insurance company. Because they understand it's not, what is the function of a health insurance company? Thank you. To make money. It's not to provide quality care to you. And if they can deny you the benefit that you paid for, they make more money. You talk about people doing absurd work. There are people in the health insurance industry whose job it is to deny you the benefits that you paid for. That's a good use of health care money. All right? So what we ultimately want to say is not complicated. And again, my friends, not a radical idea. You go up to Canada. I live 60 miles away from the Canadian border. You have heart surgery. How much does it cost you out of your own pocket? Anyone know? Zero. You go to any doctor you want. You go to any hospital that you want. Because it is a publicly funded universal system that says whether you're rich, whether you're poor, whether you're middle class, you get quality care as a right, not a privilege. That is what the American people want, and those candidates who run on that program, who have the guts to take on the drug companies and the insurance companies, will win and win big.
Senator, you propose not only to save Social Security, but to reform and expand it. How does that work? Is it bigger checks, more recipients? What's the big picture?
Look, I have a radical idea. You ready for a radical idea? All right. This looks like a radical group here. Here's the radical idea, that at a time of massive income and wealth inequality, when 3 people own more wealth than the bottom half of America, when over the last 30 years, the top 1% has seen a $21 trillion increase in their wealth, while the bottom half of the American people have seen a $900 billion decline. You want my radical idea? That maybe we create an economy, a healthcare system, and a government that works for all people rather than just the 1%. All right, that's my radical idea. Now, what was exactly the question?
Social Security.
Social Security. All right, here is Social Security. My Republican colleagues, they have a brilliant idea. They have given $1.5 trillion in tax breaks to the top 1% and large private corporations. Massive income and wealth inequality, rich getting richer. What do they need? Massive amounts of tax breaks. Then they run up the deficit, and then they come back and they say, oh boy, we have a deficit problem, and the way we're going to have to deal with the deficit is to cut Social Security, Medicare, and Medicaid. How ugly is that? And what an absurd set of priorities is that? You don't give tax breaks to billionaires and then cut back on Social Security benefits for people trying to survive on $13,000 or $14,000 a year. What do? We do exactly the opposite. We say it is time for the wealthiest people in this country to start paying their fair share of taxes. In terms of Social Security, what do? We say, okay, Social Security will be fiscally solvent for the next, I think it's 17, 18 years, 16 years. That's not enough. It's solvent today, but we want it to be solvent into the future. What do? We do what is called scrap the cap. You all know what that is? Scrap the cap. Right now, you have a situation where somebody makes, I think, about $133,000 a year. They contribute into the Social Security Trust Fund exactly the same as somebody who makes $10 million a year. What we do is scrap that cap. We start at $250,000. That's the top 1% who are doing phenomenally well. They contribute more into the system. The result of that is we expand benefits for seniors, especially lower income seniors, people who are trying to get by on $11,000, $12,000, $13,000 a year. And equally important, we extend the life of Social Security for 52 years. That makes more sense to me than giving tax breaks to billionaires.
Go ahead, Tracy.
Senator, you have long been an advocate for legalizing marijuana.
Yeah.
Would you legalize it as president for both medical and recreational use?
Yeah.
Why?
I'll tell you why. Look, I have been a long-time advocate for reforming a broken criminal justice system. And at the heart of a broken criminal justice system is the so-called war on drugs, which, as many of you may know, has done devastating harm to millions and millions of people. And by the way, disproportionately impacting African Americans and Latinos and poor people. White people smoke marijuana at about the same level as black people. African Americans are about 6 times more likely to be arrested. So look, whether you like marijuana or you don't, and I've smoked marijuana twice in my life, I ended up coughing. That was what it did to me. So, I don't go around advocating for it. But I'll tell you an amazing thing, a funny thing. I was in Nevada a couple of weeks ago, and you drive down the street, and there's this big sign from some large corporation selling marijuana, literally advertising the sale of marijuana. So look, I think people have the choice. You want to do marijuana, fine. You don't want to do it, fine. But I don't want to see whole lots of people get arrested and thrown in jail because of the war on drugs.
You've got some coverage for long-term care in your Medicare
Yes.
for All plan. There are an estimated 7 to 8 million people who've been paying into long-term care insurance already. What happens to those policies? And you also keep Medicaid in place, is that correct?
Look, we have a real crisis in terms of both home health care and nursing home care. I mean, nursing home care is just outrageously expensive. And clearly we have got to do something about it. As many of you know, Medicaid, and we do keep Medicaid to pay for that, Medicaid pays a significant percentage of nursing home care in this country. But before you are eligible for that Medicaid payment, you have got to literally pauperize yourself. So just think for a moment. I was just talking to some folks earlier today. You work your whole life, you make some money. What do you want to do with the money? You want to leave it to your kids. But now you're forced to sell off everything before you're eligible for Medicaid and get that to help you get into a nursing home. We have to improve upon that. And the other thing that we have to do big time, what we do cover through Medicare for All, is home health care. As I think I mentioned earlier, most people would prefer, if they're able to stay at home rather than be forced into a nursing home. And the truth is, home health care is a lot less expensive than nursing home care. So we should be training a lot of workers to come into people's homes and to help them be able to stay at home, which is, I think, what they would prefer to do.
Senator, there are many Americans who use a reverse mortgage as a way to supplement their income in retirement. How would you regulate the industry as president?
Well, I can't give you any specific, that's not something that I've thought a whole lot about. But the issue that we should be talking about they do that because they're hurting financially. And I think it is time to take a hard look, and I want to congratulate AARP for what they are doing. So I think if you look at our program in terms of how it deals with senior citizens, what you will find is that Medicare for All will go a very long way to making life better and less expensive for seniors. Our home health care proposal will make it easier for people to stay at home. We will expand and extend Social Security. And by the way, there's another issue I want to mention on Social Security. And that is, right now, COLAs, the cost of living adjustments, are often inadequate and often not based on a fair description of what inflation is. Right now, what we do is we look at the whole population in determining what inflation is, and then that's what the COLA is that seniors may get. But the truth is that seniors' purchasing practices are very different than the whole populations. Seniors will spend more money on health care, they'll spend more money on prescription drugs, which are going up a lot faster than computers and widescreen TVs. So what we need to do, by the way, is segregate the index for senior inflation, which will mean a higher cost of living adjustments.
Senator, another issue with long-term care is that there's just a severe shortage of workers for nursing homes, for in-home care. What would you do about that?
Well, what we would do is determine how we can pay those workers who do enormously important work. I mean, we have things really kind of upside down. We have 25 hedge fund managers in America who make twice as much money as all of the kindergarten teachers in this country. All right, that's a little bit absurd. I'm not quite sure what hedge fund managers do that is productive, but they sure do make a lot of money. I do know what home health care workers do, and that is enormously important, and I've met many of them. They are compassionate, good people who make terrible, terrible wages, often don't have the health care benefits that they need. So when we talk about changing priorities in America, it means helping and supporting those people who do some of the most important work. Who are those people? They are child care workers who are underpaid, don't have benefits. They are home health care workers. They are teachers who do some of the most important work in this country and are not adequately reimbursed. So part of what we are trying to do and what our entire program is about is changing priorities in America. It's the saying that in an aging population, we all want well-trained, compassionate, good people to be able to come to our homes to help us when we need that help. That's difficult work, sometimes emotionally draining work. Those people deserve to be adequately paid. And I'm very proud, by the way, as somebody who led the effort to raise that minimum wage to $15 an hour that had just passed in the House the other day. We've got to get it passed in the Senate now.
Senator, this will be the last question, and we don't have much time left. Broadband is inaccessible in many areas.
Yep.
Folks often can't even afford it if it is available. How would you regulate the industry?
Look, well, it's not a question of even regulating the industry. It's a question of making sure that in this country, and this is especially true for rural America. I mean, if you were well, you get me going on this one too. I mean, in rural America, we're seeing in many counties a decline in population. Schools are being shut down, downtowns are being boarded up. I come from one of the most rural states in America. I think the rural way of life is a good way of life, but it has to be supported. Instead of shutting down rural hospitals, why don't we make sure that all people in underserved areas have the health care that they need? If you talk about economic development, how do you have economic development in a small town if you don't have good quality cell phone service and good quality broadband? We invest in those things. God, I mean, it's really quite unbelievable that in the year 2019, in rural community after rural community, people do not have high quality, affordable broadband. This is the United States of America. We can do that.
Senator, thank you so much for, I'm going to give you 30 seconds, though, to wrap up. So thank you for answering our questions, but you can have 30 more seconds to wrap up.
Look.
Not kicking me off yet.
We are the wealthiest country in the history of the world. We're not a poor country. But we have got to learn to think big and not small. And that means telling the pharmaceutical industry they're not going to rip us off anymore. Telling the insurance industry that the function of health care is to provide health care to all, not to make billions in profit for the stockholders and the CEOs of those companies. So as a nation, and what this campaign is about, and it's what I mean when I talk about us, not me, no president can do it alone. We need millions of people to stand up in the fight for economic justice, for social justice, racial justice, and environmental justice. By the way, yeah, maybe we should tell the fossil fuel industry that they cannot make billions while they destroy the planet, in passing, of some significance. So what we need to do, it's not radical. It is creating a government which does what the American people want. The American people want health care for all. They want decent wages for workers. They want to tackle climate change. They don't want to get ripped off by the pharmaceutical industry. They want a criminal justice system which does not have more people in jail than any other country. They want real, comprehensive immigration reform. They want good schools for their kids and well-paid teachers. These are not radical ideas. These are ideas that are supported by the American people. Problem is, in Washington now, you got a corrupt political system. And you have a situation where Congress listens to the very wealthy campaign contributors who fund their campaigns. I am proud to tell you that we have now received 2 million individual contributions for our campaign. That is an all-time world record. That's the good news. Bad news is the average contribution is all of $19. But I'm proud of that too, because that means that working people and poor people are contributing. So, look, we are living in dangerous and difficult times. with a dangerous president. And I think it is time that we had a government that works for all of us, not just the few, a government which brings us together, not tries to divide us up. So let me conclude by thanking you and thanking AARP for all the great work you're doing. And as president, I will look forward to working with you all. Thank you.
Thanks for being here.
Thank you.
Please welcome to the stage Montana Governor Steve Bullock.
Governor, your first question is going to be from the audience, from this nice lady right here.
Hi, nice lady.
Hello, nice, nice sir. Hello, my name is Holly Schweitz. America and Iowa's low single-digit unemployment rate are well known. But for people with disabilities, the employment rate is a mere 19.1%. My son is a 2010 graduate of the Iowa School for the Deaf here in Council Bluffs. Vocational rehabilitation services is woefully underfunded with waiting lists for that program and developmental disability services. There are limited opportunities for training for people with disabilities to engage them in work experiences and encourage independence rather than dependence on public assistance. What kind of plan do you have to increase services and programs for people with disabilities, young and old, in relation to employment and training?
Yeah, and thank you so much for the question. And I sure hope you're proud of your son and all of his accomplishments. And it is one of the things that I guess I'll put it in two different ways, one of which is what's happened at the state level and what happens at the federal level. Because when you look at everything from the privatization of Medicaid here, or you look at what often you're funding on the state side, that has so many of the impacts on both your son and everyone else. And I think that's one of the challenges all the way along, is that I see that as a governor. Like, I can tell you things that I've done for individuals with disabilities and our Voc Rehab program in Montana. And recognizing like a sub-minimum wage for individuals with disabilities doesn't make a heck of a lot of sense along when what work provides dignity and opportunity along the way. Funding Voc Rehab programs, recognizing the importance and removing barriers in each of our communities for greater employment, and recognizing also that an individual with disabilities is going to be able or have different challenges going to the workforce, and you can't just meld them all together. There was a guy named Jack Markell who was the governor of Delaware, and I'm currently National Governors Association chair. When he was chair, though, he put together an overall work plan of here are what governors can do and ought to be doing to make sure that if you really want to have full employment and if you really want to have full opportunities, What we need to also be doing is including the disabled. I think that leadership often happens at the state level, but it's incentivized at the federal level as well. And as the next president, I do everything I can to both partner with the states and provide the funding, because work provides dignity and opportunity, and I think every workplace, every inclusive workplace, actually all the employees are that much better off as well.
Okay, Governor, you've said that there are any number of paths to make health care more affordable, but you're supporting adding a public option to the Affordable Care Act. Why is that the right path?
Yeah, and I'd also say that I'm an AARP member. I suppose there's a few of us there. But I also probably bring a different perspective in some respects than most of the people on this stage, because before I got into public office, I was a lawyer for AARP Montana. And mostly I worked on affordable energy issues, but it underscored to me something that all of this matters, right? I mean, nobody should have to choose between paying their heating bill and buying their food or paying for the prescription drugs. When I look at healthcare, directly to your question, Kathy, we ought to all be able to agree that, look, we're the only industrialized nation in the world that doesn't have access and affordable health care. And we can get to accessibility and affordability. And what I would do is, certainly first, like in Montana, even with a 60% Republican legislature, we expanded Medicaid, providing 100,000 Montanans quality health care. I think that the best is to do more or less a Medicare or a public option for anybody that wants it. The ability to buy in from the federal government. And at the same time then, that will cause some push and pressure along the way for price competition. I would also turn around and say, that, and I have done a lot on outside spending, dark money in our elections. We pay more for prescription drugs and healthcare than any country in the world, and we have nothing to show for it, and the prescription drug companies are doing pretty damn well. And working to get rid of both surprise medical billing and out-of-network charges. You could do that at the federal level. Start transforming the overall payment models. But I don't think that the best way to do it would be to get rid of 80% or 70%, 180 million people that have employer-sponsored health care. So many of them like it. Sometimes you don't like either the costs or the deductibles. We can work on that without disrupting the entire system and starting anew, from my perspective.
Senator Sanders was just out here and said that the primary goal of private insurance companies is to make money and not to provide health care. Are you leaving people with what it would be less than what we would consider to be universal health care if so much of it continues to be covered by the private sector?
Well, look, 25 million folks about don't have any health coverage at all. If you expanded Medicaid in all these states, that'd cover about 15 million. Now we're down to about 10 million. The question becomes affordability on an exchange, from my perspective. By having a public option, you're going to be able to make it more affordable along the way. I think that we also just have to look at, as we get there, and what's interesting, and a guy named Mo Udall, who ran for president a long time ago, he said, when Democrats organize a firing squad, we usually do it in a circle. Meaning we're real good at tearing apart one another. And here we are at a time, 2.5 years in this administration, where they're trying to rip health care away from every single person, completely dismantle the Affordable Care Act. And not only does that go to that base health care, but when you talk about keeping Medicare alive or the donut in drug costs, that's part of that as well. So I think that while there's differences in approach, I just don't think the best way to get to the point of universal is disrupt 70% of the people. We can control costs and we can increase accessibility without throwing everything that we've done and starting over. And I guess I'd also add, too, that I think I bring a little bit different perspective than folks from Washington, D.C. When I'm hearing about health care, it's when I take my son to Target and somebody walks up to me and says, here are my challenges. As a governor, you're right on the front line each and every day of the challenges. And so many times I think in Washington, D.C., and this isn't necessarily talking about Senator Sanders, but it's just a general, we put out these plans that go no further than a press release. And talking at times has become the replacement for doing. I don't have that luxury in my job. And I think as we talk about all these plans, we also have to say, how are we going to attain them? How are we going to pay for them? And then how are we actually going to provide that much greater opportunities in a time where it still may be a divided, whether we like it or not, a divided Washington, D.C. politically? I think we can do a lot more than what we're doing now.
Governor, you will be on the debate stage.
Yeah, oh, shoot, will I? I had no idea, Kay. What the heck happened?
During the last debate, the candidates were asked if undocumented immigrants should be covered by government-paid health care, and people raised their hands. What would you have done?
Yeah, thanks for the question. First, so I wasn't on the first debate stage. I got in apparently a little late, only about 7 weeks ago, notwithstanding, like you go back to when Bill Clinton was running. He didn't even announce until October the year before. But I couldn't get in earlier. My legislature was meeting. It meets 90 days every 2 years. Got out the day before yours in Iowa did, or 2 days before. I had to get Medicaid expansion reauthorized. We tried to do it by ballot initiative. Tobacco companies spent $26 million killing it. So I had to stay there and actually get that because 10% of my population relied on that. And I'll tell you the truth, if it ever came to chasing 100,000 donors or getting 100,000 people health care, that's the easiest decision I could ever make. But I am going to be on the next debate stage, and I think that not just in that question, but in many other areas, that it seemed like some of the debate within the Democratic Party is detached from individuals' everyday lives. I mean, when I meet a teacher here in Iowa that says, you know what, I had to take a second job just to pay for my insulin payments. Or there's a county or a local city councilor who turned around and said, you know, my son had a surgery on his hand. He got his hand caught in a door, didn't quite get it all fixed, cost us a lot of money. We're now going to have to get a second surgery. And when the decision is fixing my car or paying the money to get my kid's hand fixed, an easy, easy decision. Look, I think we need comprehensive immigration reform. That's where I would begin on this. And I think that there are steps. I don't know if there's going to be any questions on that. We can talk about it. But my approach on that, and we've got to figure out for the about 8 million undocumented immigrants living in this country, 2/3 of them have been here for a decade. We got to work on immigration reform to get them to a path to citizenship. But like overall health coverage for folks, I would not provide.
Shifting to social,
sorry. Before he goes on, isn't that a humanitarian issue, though? You know, we have people in this country. A lot of them are paying taxes. They're doing work, and because they're so they're not on a path to citizenship. But we would deny them health care coverage.
Yeah, and I'm not talking about like ER room, but it's a humanitarian crisis, right? That teacher who's invested with the most important things that at least I have as a father is working a second job. It's a humanitarian crisis that local city councilor has to make those decisions. And I think one of the things, though, in this, look, the biggest problem right now with immigration policy in the United States is who we've elected president. He is dividing our... He's ripping apart families, he's ripping apart communities, he's ripping apart this country. There are things when you look at the separation at the border, that was by his choice. That wasn't required. This is a humanitarian issue, but there are many, many steps we can take. I mean, I think Democrats believe in border security. We don't believe in an 18th century solution, this wall, to a 21st century problem. We don't agree in cutting off aid to the Central American countries, which is down 2/3 in the last 5 years. And we do believe in, if you know no other country than this, the Dreamers, their protections were ripped away by this president, or a path to citizenship for the other 8 to 11 million. We ought to be able to figure that out.
Let's shift to Social Security.
Well, let's do.
This past year, you vetoed a bill that would have exempted the first $30,000 an individual gets in Social Security income from Montana state income taxes. As president, what would you do to taxation for retirement savings.
Yeah, and generally, like, right, Social Security, what an amazing program. If you look at 35% of our seniors back in 1959 were living in poverty when it first came in. Now it's less than 9%. Now that's still 9% too many. And it's a program that not only has provided economic dignity, but it reflects our overall moral values. That people as they age ought to be able to live with dignity and respect. The specific bill that you reference, I mean, I have this legislature that loves to come to me and say, here are all these tax cuts, but never wants to raise revenues. And we're kind of in the same position in Washington, D.C., where, look, I don't think we should be raising taxes and everything, but the Republican Party, and the way it's been co-opted by the outside spending money, can't even say they're going to be doing fee increases. So any time that I'm going to provide a cut, I actually have to figure out the revenue, because Washington, D.C. hasn't fully passed a budget in 22 years. If I did that in 1 year and it wasn't balanced, I'd be kicked out of office.
Let's just tick-tock through a few socials. Would you raise the retirement age, yes or no?
Would I? No, I would not.
Will you get rid of the cap on taxation?
Are you doing these TikToks on me?
Well, I'm just trying.
Raise your hand at least.
Oh, thank you.
Would you raise?
Put a foot out, or maybe? No. Would I raise the cap on? I think when we look at overall solvency of the Social Security system, the idea that those that earn more pay a little bit more, yeah, I think I would have to take a look at this, because there's also folks that have paid into this all their lives, and we got to make sure that they get the benefits out of it.
2 years ago, you had to balance your budget after oil and gas revenues tanked in your state, and you had to cut you proposed a budget that cut $27 million from senior services and long-term care. If you're the president and facing the need for budget cuts, what do you do when you face senior services, things like the Older Americans Act, for example, that has lots of opportunity for in-home care for seniors?
Yeah, so we had a little bit more going on than that, too. We had an inflated revenue estimate, and it said, walked out of legislative session and said, we're never going to get this money, so the legislature kind of put in, here are the places that you'd cap or cut, or you'd have to cut this amount of money. We had a record fire season, most expensive fire season in my state's history. And that's something that you can't just say, oh, I'm not going to pay for that, as communities are literally burning and we're losing the lives of firefighters. And you look at it as state budget, about roughly 80% of the dollars go into educating, medicating, and incarcerating, right? Those are the three areas that your state budget. Federal government has defense, but the vast majority of expenditures go to. So did have to make some difficult cost-saving measures that impacted people's lives, because my legislature also wouldn't raise revenues along the way. So my priorities, though, is, the federal government, and that's another one of those examples where it's the federal-state partnership. Our challenges of providing continuing services in some respects in long-term care areas was because the state wouldn't put in the money to match. I think the federal government has to continue to be the partner that actually pays the most, and you shouldn't be balancing budgets on the backs of seniors or anyone else.
Several Western states have either legalized marijuana for medical or recreational use. You signed some changes in Montana's program this year. As president, how would you prosecute marijuana policy at the federal level?
So and this is just, well, I guess I was going to say my opinion, but yes, it's my opinion, or it wouldn't be up here. I mean, I don't think the federal government should be prosecuting marijuana policy. I mean, I think that this should be left up to the states. Medical marijuana has been for Montana, and we've gone through the evolution of this program since I was Attorney General, before I was governor. And it goes to individuals in need, and it makes a meaningful difference. But you always have the barriers at the federal level, both the scheduling of it as a drug and the difficulty of banking any of the dollars being medical or recreational. So I think the federal government should get out of the way, and this is a state-by-state decision.
Turning to more traditional medicine, you're on the record as not favoring reimportation of prescription drugs from places like Canada. Why not?
Well, I think that there's a couple of different things that, first of all, you often hear, well, the prescription drug companies say, well, we do all this research and development, so it's not fair to get them from other countries. They spend more on advertising right now than they do on research and development. Reimportation is not my first priority, or what I'd like to do first to try to get drug costs under control. It is, to me, a sign of both the toxic influence of money in our elections and how broken Washington, D.C. is when the biggest purchaser of prescription drugs, the federal government, can't negotiate drug prices. This is just insanity. So goal number one for me would be to lift that and be able to negotiate for a fair price. If that doesn't work, if we don't get to the point where prescription drugs are a heck of a lot more affordable, because just like I was saying at the start, when I was doing energy issues, literally had people talking to me, seniors, AARP members, saying, I have to choose between heating my home and picking up my prescription drugs. Nobody should have to make that choice. If you can't get to that point, then I think there are things to look at, from importation from other countries and possibilities of indexing and things. But the first ought to be that we ought to be able to just negotiate for a fair price. Not trying to say that prescription drug companies have to give away all their drugs, not make any money, not invest in research, but if you're spending more on advertising than you are on your research, you shouldn't be getting a tax credit for that. Shouldn't be able to write that off. And then you ought to be able to, just like in every other area, we negotiate for the cost, or at least we can get several different options if we want to get our car fixed. We ought to be able to get the ability to negotiate when it comes to prescription drugs.
What should the regulation be, if any, additional on the reverse mortgage industry?
So the regulation on reverse mortgage industry, and this is when I was Attorney General before Governor, was part of as these banks took people apart, not just on the reverse mortgage side. The level of financial fraud in some respects and what it did to people's lives. And then we took all our settlement money and tried to get people back into homes and figure out ways to look at it. And I think that to a certain degree, and it's not unlike, we banned payday lending in Montana. The idea, right, that somebody, and there comes a point where people are preying on those in financial need because they know that those in financial need literally have nowhere else to turn to. And I think that reverse mortgages can be much the same. And from that perspective, what we've even seen in this last 2.5 years, part of not only when we were going after the banks, but we put together the Consumer Finance Protection Bureau, and to say, let's crack down on the abusive practices. And what we're seeing time and time again under this administration is they're trying to dismantle the Consumer Finance Protection Bureau. So I think that part of it really just does look at what are the abusive practices. I don't have a specific 19-point plan, but it's one of these where it makes pretty well common sense, where if you're ripping off somebody and they're paying usurious rates and they're not even going to be able to stay in their home along the way, it's probably not what we as Americans should accept.
One of the reasons that seniors seek out financial help in the form of these reverse mortgages or other ways of doing that is they can't pay for their long-term care.
Yeah.
It could cost $100,000. Long-term care, the idea was originally incorporated into the Affordable Care Act, but it turned out to be unaffordable. Yep. So how does your plan deal with the cost of long-term care?
Yeah. And I look at this, we hear about these big abstract policy stuff. I kind of view it through, we'll call it Bill and Rosie. Bill and Rosie were my grandparents, and Bill was a tire salesman, Grandpa Bill, all his life. And you know, I did pretty well. They retired, they did well. And they were living in the Smoky Mountains, Franklin, North Carolina. Rosie got dementia. Bill had never done the books, and he was the most trusting guy in the world. There I was in Montana having to try to get a power of attorney because Bill was giving away his money to darn near everyone, and he wasn't giving it away, he was getting scammed out of it. So I had to take control of Grandpa Bill's checkbook. Talk about taking away dignity. And then we got to the point, because Grandma Rosie was in a long-term care facility, where between what he lost by the scammers and what that was paying, they'd spent their whole life working so damn hard, and things got more and more difficult. And where it ended up, though, is even before, is Bill had to say, all right, now I have to exhaust all my money. Because that's the only way he would live in dignity when he got older, is Medicaid would pay for Bill's long-term care at the end of that. And we're paying $154 billion a year through Medicaid for long-term care. It doesn't make sense when we know that 2/3 of the folks, I won't ask if you're over 65, but are going to need that long-term care. So I think that, you know, and we've been looking at something where you could add a supplemental program to Medicare that'd be like, the price out like $35 or $40 a month. And that'd be like an insurance along the way for those that wanted to pay into it, and then that would cover long-term care. I think that's probably one of the best ways to do it. Another thing, though, then we also have to look at, you know, that often, especially in rural areas, the long-term care facilities are hooked on the hospitals, and we have about 20% of our hospitals at risk of closing, rural hospitals in this country. And so we've got to be investing in, and it's often Medicaid expansion and other things, keeping those rural hospitals viable to keep the long-term care facilities viable as well.
Governor, thanks for answering our questions. We'll give you 30 seconds to wrap up.
That's all?
Yeah,
I thought we were just getting going. No, first I so appreciate you all taking a little bit of time, listening to what I have to say. I'm 7 weeks in, this is, I think, my 7th trip to Iowa. And so appreciate also what I'll call Iowa nice. So I meet people, they say, yeah, you're on my list. Well, is your list 37 or is it 4? What I'd ask of you is, I think I bring a different perspective. It's a perspective from a rural area like many of you are. Perspective from outside Washington, D.C. Perspective of actually having to work and make government work at a time where government is so divided. So I would be remiss if I didn't wrap up first by thanking my former employer, AARP, that was on the Montana side, but thanking you all for taking some time out of Saturday afternoon when you could be doing anything else, and asking you also to keep a close look, even in this field of 37 or whatever it is, on what I'm saying and what I'm doing, because I believe that I can make both the economy start working again for working folks and also our political system. And most important, probably, I think this dangerous time in this 240-year experiment called representative democracy. And we've got to figure out a way that we're handing off something to that next generation better than what we got. So thanks for having me, Kathy. Thanks for having me, Kathy. Thank you. Thanks. Yeah.
Please welcome to the stage South Bend, Indiana Mayor Pete Buttigieg.
Mayor, thanks for being here. Your first question is going to come from the audience and right here in front of you.
My name is Nancy Wright. I'm an educator at a public school nearing retirement. My husband and I both have pre-existing health conditions, and we want to make sure Medicare and Social Security will be there for us and others when we retire. What are your plans for protecting our Social Security and Medicare?
Terrific. Well, first of all, thanks for choosing a career in public education. I married an educator, so I get an education about education every day, and it's really important work. And I have a very personal stake in making sure that Social Security and Medicare are there when you retire and when I retire. And if you look at the numbers, that won't happen without some adjustments. At the same time, I think there's a little bit of scare tactics going on to make us think that we have no choice but to trim benefits. When actually, if we make some common sense decisions around properly funding Social Security in particular, we will be able to make it sustainable, again, not only for when you retire, but when I do as well and beyond. For example, if we just elevated the cap on the level of income eligible for payroll taxes from $135,000 to the $250,000 neighborhood, that would go a long way towards sustainability on the Social Security side. Medicare side's a little bit of a different picture because the reality is we just won't get there without also figuring out a way to lower costs. But in a country that spends more of its dollar on bureaucracy relative to patient care than pretty much any other developed country when it comes to health care, and doesn't have the results to show for it, we know that we can do more about containing costs without reducing people's access to care if we undertake measures that range from more of a public health approach to deal with the conditions that drive health before you even get to the doctor's office, plus making sure more people have access to health care coverage to begin with, which is why I believe we need to move toward universal health care, and making sure that we do some of the maybe less glamorous work under the hood to make the system more efficient. But if we take those steps, as well as making sure that those who are in the best position to be able to afford to contribute do so, we should be able to enjoy the current or better levels of benefits from Social Security and Medicare for a very long time. Okay. Thank you.
Mr. Mayor, you said you support a public option under the Affordable Care Act. What would be the role of public insurance under your plan? Roughly 180 million people still have private insurance. How does your plan treat them?
So my expectation is that a quality public plan, I would call it Medicare for all who want it. So you take a version of Medicare, you put it on the exchange, and you make it available for people to buy into if they want to. My expectation is that's not only going to be expanding availability to coverage, it's actually going to be better. It's going to be cheaper. And the reason I believe that is if you look at different developed countries, ones that have that kind of robust public involvement have more cost-effective care than we do. And so it is a chance to demonstrate that public option will provide the kind of efficiencies that we were just talking about. It's also one last dare, though, to the corporate world to come up with something better than they have. If they do, great. I'm not counting on it. And so I think what will happen over time is that this will become a very natural glide path toward a Medicare for all environment. Not by flipping a switch and banishing the private sector, but just by putting something better on the table and letting people figure it out for themselves.
How long do you think that process takes?
Long enough that we're going to have to undertake cost cutting in the years through that transition. It's not going to be a 2-year thing. But that's okay because more and more people will see that they've got options. And if you're not in a hurry to get rid of what you've got, that's fine with us.
And Medicare Advantage, Medicare Part D, both covered by private insurers under the Medicare umbrella. Do you continue with private insurers for those sort of supplemental plans?
Only if they can deliver in a way that is better than what we could provide on the public side. But it's a good example of why, and again, there's a little bit of politics going on around this, but Just a little,
No.
right?
What? Politics.
The truth is, even in countries that do have something like Medicare for all, or something much further, which we're not proposing, like outright socialized medicine like they have in England, even there's still a private sector. There's still private clinics and private insurance. So this is not about abolishing a huge part of the American economy. This is about how to make sure that we can get coverage and care without leaving Americans to the tender mercies of the for-profit system.
Let's talk about the more immediate future and the already existing Affordable Care Act. Until you get this ramp going, do you increase the subsidies?
We should, because again, we can't wait to get all the way to where we want to go to make sure more Americans are covered. But look, it's not just a matter of increasing the subsidies. The Affordable Care Act is under attack. This is very personal for me. My mother-in-law gets chemotherapy that her life depends on. It's for skin cancer. The thing looks like a tube of toothpaste, but it costs thousands of dollars for every treatment. And they got a mom and pop landscaping business. There's no way she would have health insurance without the Affordable Care Act. And this president, this administration, they are doing everything that they can to undercut it. And so first of all, let's do no harm. Let's stop taking apart the foundations of the ACA. Then let's fortify it, but let's not let it be an excuse for inaction on the bigger project of extending health care to all.
One of the previous candidates who participated in this forum said if the party embraces Medicare for all, Republicans will paint us as socialists and it will doom the party's chances in 2020.
Yeah.
You mentioned the discussion among Democrats. Do you have that concern?
So my position is a little more moderate because I think it's the right thing to do. But here's my take on the politics of it. If we adopt a platform that's way out to the left, they're going to say we're socialists. If we adopt a more moderate or conservative platform, they're going to say we're socialists. So we might as well just do what we think is right, make the case for it, and then let them do what they want.
As a veteran, have you ever used the VA health system? If so, what was your experience?
No, but I have used the military healthcare system, and it was excellent. Everything from getting a dental situation fixed with remarkable speed. Like I told the doc something was wrong, and I had something a couple weeks ahead coming up in a couple weeks ahead with my civilian dentist, and 40 minutes later I was a little sore and I was walking out of there and the problem was fixed. Didn't know what happened to me exactly. But so look, the idea of the VA system is that there are some things that, first of all, this is not a gift, this is a promise. This is America keeping a two-way promise that was made between somebody who made that commitment to the country and the country making that commitment back. Secondly, different wars have different wounds. And we, just as a country, wouldn't know what we now know about Agent Orange or about traumatic brain injury coming out of things like the Iraq War if it weren't for the specialized care that only the VA is able to deliver. We know the VA needs work. We know we need to reduce wait times. We know we need to increase accessibility. Actually, the biggest interaction I've had with the VA was being part of an effort to deliver a larger clinic to our own community, which did a lot of good. Because you don't want people to have to drive hours to get basic care, which is why I think it's fine for there to be some measure of choice to get a prescription filled or something if you got the sniffles. But fundamentally, we cannot move down this road of privatization that would leave the VA unrecognizable relative to what so many veterans count on, even as we know we've got to fix it and improve it.
And the mental health aspect of especially the current wars is severe. How is the VA doing enough to deal with that? And how do you manage with the severe mental health issues in the civilian population?
Well, first of all, we got to break the silence on mental health. And it's starting to happen, but we got a long way to go. And it starts at the top. I mean, some of this is a policy question, making sure we have actual mental health parity in coverage, whether we're talking about the VA or whether we're talking about the health insurance system more broadly. But a lot of it is just the way we talk about these things, because the reality is every family is impacted. I mean, we're talking about something that will affect 1 in 4, 1 in 5 Americans in their lifetime. And while sometimes we put parity on the books, it's not actually happening in reality. So maybe we say that you can get coverage for mental health, but you can't find a provider where you live. Until we fix that with adequate resources and a culture that says it's okay to talk about this and necessary to deal with it, we are going to continue to see struggles, especially in communities where providers are so sparse.
You mentioned that 20-something and 30-something Americans really don't have confidence that the Social Security system may be there when they reach retirement age. Would you consider raising the retirement age because people in those cohorts are living perhaps longer than the current generation?
I don't think that's the answer. We can, again, if we choose to, fund a Social Security system that is sustainable and that will be there for us
by lifting
when
the
we
cap
need
on
it.
income?
For example.
Okay.
Now, that being said, I think we should take a bigger look at how we organize benefits from retirement savings to beyond Social Security, employer-based retirement savings, to vacation, family leave, sick leave, all of these things, because we're still designed around the idea that you could have one employer for your whole career. And for my generation, or folks younger than me, we're likely to change professions more often than my parents changed job titles. And so it makes less and less sense to have anything from health insurance to the way you get your vacation pay organized around the idea that you're going to spend your whole career in one place.
So then do you create a government system whereby the employee and the employer contribute and then it's portable wherever you go? Does then the government manage that money?
Yes, I believe it works better if the government offers to house it. But there has to be an employer and employee contribution. And stay tuned for more. As the youngest candidate in the race, I'm actually excited to be the one talking a lot about retirement. So we'll be sharing more on how we view that in the future. But you mentioned that word portable. And it's so important because people are moving around between employers. And I would also add to the word portable the word prorated. And what I mean by that is, if you're driving Uber 7 hours a week, and that's part of how you put together a living, then 7 divided by 40 ought to be how much that helps with your retirement and your vacation banking. And we haven't gotten there, but we're going to have to quickly if we want our benefit system to keep up with where the economy's headed.
You're on the record, I believe, as supporting allowing Americans to import prescription drugs from other countries. How do you ensure the safety of those products, given that there's been some high-profile cases of legitimate pharmacies having to pay multi-million-dollar fines for importing basically fake drugs?
Mm-hmm. Well, I believe the FDA is up to the task if we are committed to supporting the FDA in its enforcement capabilities. I mean, right now, far too many of our agencies are run by folks who don't seem that serious about holding industry accountable, right? I'm being diplomatic here. And yet, I'm absolutely convinced that a country that's delivered the standard of consumer product safety that we expect can apply that to things like imported drugs.
Are there other ways that you would look at to try to reduce the cost of prescription drugs?
Absolutely. First of all, and I'm guessing there's not much daylight among us Democrats running for president on this, but just in case it's not clear that I believe this, the government should be able to negotiate drug prices with drug companies. So I think that's important. I think we do need a cap on out-of-pocket expenses, and we need to require that. By the way, when I talk about the government's negotiating power, I don't only mean Medicare. I also think that private payers should be able, if they want to have the Health and Human Services Secretary empowered to conduct those negotiations. And when you get to the really extreme cases of pharmaceutical companies misbehaving, I mean, in ways that are really just putting the squeeze on people, seniors or otherwise, who are just trying to get through life and are forced to choose between basic necessities and life-saving medication, or cutting back on dosage because it's unaffordable. When it reaches a certain point where it's clearly abusive, then we have to have a government empowered to act on that, including being able to use our power to look at the intellectual property that's behind that in cases of extreme abuse, and use that as the way to get them to the table for the kind of arbitration that I think will actually lower prices.
And what do you make of the argument that those kinds of things, especially the patent restrictions, would chill innovation? That insurance companies are not going to be able to put as much money into research and development?
Well,
not insurance.
Pharma company. Yeah,
drug companies.
look, I support, if you invent a wonder drug, I want you to be rewarded for it. And a lot of experiments don't work out, and that's one of the reasons why you use the profits from the drug that worked well to cover the cost of all the things that didn't work out. That's fine. But look at the rate at which profits have grown, and look at the rate in which investment in research has grown. Guess which one's higher? It's the profit line. This is not about saying you can't make a profit. This is about saying you cannot harm people unnecessarily by manipulating the patent system, like making a little cosmetic change that isn't even real and then saying, oh, we got to start the clock all over again on the patent. It's in cases of abuse that we need that kind of enforcement power.
I want to move on, but just one really quick question. Should the federal government be in the business of manufacturing generic medication?
Potentially. There are certainly cases where it seems that the private sector cannot deliver quality, affordable drugs. And usually when we talk about public option, we're thinking about the public option for insurance. But if you zoom out and think about it, we've got public options on lots of things in this country. A library is a public option. A community-run swimming pool is a public option among different ways that you could get access to a swimming pool. And we should think a little more broadly about where public options are appropriate in order to fill some kind of gap, some kind of hole in the market that is working well in some areas but not in others.
Pew Center research indicates that the younger you are, the more you support the legalization of marijuana. Would you, as president, have the FDA, legalize the sale of medicinal marijuana in the corner pharmacy? Would you legalize it for recreational purposes?
I would. And while it's true that a lot of this is viewed as a young person's issue, if you look at the average age of those who rely on medical cannabis, it's actually, I believe, in the 50s.
In Iowa, it's currently 57.
Okay, so I think that tells you something. And I don't do this lightly. I don't recommend smoking anything. But not only are there important medical uses, but we've just hit the point as a country where there are a lot of offenses, including, I think, a lot of nonviolent drug offenses, where the way we responded to it, the incarceration, is actually doing more harm to society and costing us more than the offense itself did. It's not about saying, everything is, it's not about ignoring that there are public health consequences and questions around things like the use of marijuana. It's about asking whether we've made the right set of choices as a society to help make ourselves healthier and better off. And when it comes to American drug policy, I don't think anybody can look at it and say that it's working well. And when you add to that the racial disparities around the way it's been applied, we clearly have to undertake a very deep redesign of how we think about this and many other drugs.
How does your healthcare plan deal with the significant, sometimes backbreaking costs of long-term care? It could be as much as $100,000.
Well, I think that there are several things that we need to do in order to make it possible for care to be affordable, but also for people to be able to age with dignity and comfort for as long as possible in their homes. Some of this is actually separate from what we would call a long-term care system. It's things like making sure that we invest in the right kind of public transportation, that we unlock the power of telemedicine to help reach people wherever they are. I've proposed a national service program that tries to create the same bonds that I got to from military service with other Americans, but without having to go to war to get them. So the idea is to create 1 million opportunities for service so that it became just the norm, where you graduate high school, first thing you do, whether you're going to college or going into the workforce, when you're applying, the first question you get is about your service year. And what that has to do with this is that one of the elements of that would be an intergenerational service corps that could work with seniors on things like installing features that would allow them to stay in their home longer. But there's also no question that we've got to be able to deal with the long-term care system. That includes making sure that we have better pay in the field. It's one of the reasons I support an increase in the minimum wage, because so many healthcare workers are at minimum wage. And there is a crisis of recruiting people to work in long-term care. Another thing we have to do is we have to have an insurance system to help manage these costs. I would make it part of my Medicare for All Who Want It plan. You would be able to have that kind of coverage. And I learned about this the hard way when we were sitting at the beginning of this year with the social worker when my dad became very ill. And, you know, I make decisions for a living, but I didn't really understand some of the decisions that you're confronted with until, as so many families are, we were facing this. And basically the message we got from the social worker was, you know, the best way to make this affordable is to spend your entire life savings so that you are now low income enough that you qualify for Medicaid, and then that'll pick it up. That is no way to run aging in the most advanced country in the world.
In reading through your National Voluntary Service Program, it appears that you would give people the opportunity to expand broadband service.
Yes.
Do you think there's additional regulation of the industry necessary, and that many Iowans who have access even to high speed aren't buying it because it's too expensive?
Right. So this is another example of when I said earlier I'm a fan of public options in more than just healthcare. A friend of mine who's the mayor of Chattanooga, Tennessee, found there was a similar issue in terms of access to broadband in his community. And so they just set up a municipal option. And the remarkable thing about the track record of these is when that's on the table, the private operators wind up becoming a lot more competitive in their pricing when they got that kind of competition. And so, yes, regulation may be part of the answer, but I think competition might be the better part of the answer. And we should look at what that can do to deliver broadband in areas where it's either not available at all or not affordable for too many.
Well, there are millions of Americans who are fighting for equal rights in various ways. The age discrimination has been illegal for a long time, and yet it's one of the more prevalent types of discrimination that people face in the workplace. If you're president, what do you do to make sure that people have equal opportunity in the workforce no matter how old they are?
I do think we need to beef up the enforcement of those provisions. I don't think an employer ought to ask how old you are when you're applying for employment. Age bigotry is real. It doesn't get talked about as much. But
you don't have to ask, though, really, do they? I mean, it's pretty easy to find out.
Well, but the point is they should be able to demonstrate that that is not impacting a decision. And, you know, in my administration, well, I came in very young, so it was inevitable, I guess, that many of the people senior people who reported to me were also considerably older than me. And I had the unique experience of being mentored in many ways by people who I had also hired. And the diversity in many ways, including age, in our administration made it a more effective administration. And we're trying to do the same thing in my campaign. And that extends to the whole alliance of supporters we're trying to build. It's intended to be a generational alliance because, you know, I saw a friend of mine joke that the conditions our country are living in right now is like God punishing our generation for ever telling our parents that we were jealous that they got to live through the 60s. But the 60s was characterized by generational conflict, right? And what I think is so remarkable now is a lot of issues where there's very strong generational energy in the activism. I'm thinking, for example, of the March for Our Lives and the way young people have taken to the streets to ask the generations in charge, basically say, you got to do more to keep us safe. The remarkable thing is whether it's that youth-led movement or the Women's March or others, as I see in the pictures from before, young people taking to the streets, but instead of them going out there to fight their parents and grandparents, a lot of times I see their parents and their grandparents at their side cheering them on. And it's a really inspiring thing, really important thing to see. And I think we need to build at the moment when we're being divided and wedged off against each other in so many different ways. I think we have a chance to model something completely different. And obviously I'll seek to do that in my administration, but I hope that voters will observe that I'm also doing that in the way that our campaign works.
Okay, would you like to take your remaining time to wrap up?
Sure, and I see from the little iPad there that I got about 20 seconds left, so I'll try to respect the limits. Let me just, first of all, thanks so much for your work and for the opportunity to be here. And I'll just close by saying what I might have said if there were an opening statement, which is to explain what I'm doing, because this is admittedly not a traditional candidacy. The reason I'm running is that I think we're running out of time to do things differently. And the choices we're going to make right now, I believe, will decide what the next 30, 40, 50 years are going to look like. There are these moments that come along once in a while in history, and I think we're in one of them, where on everything from climate to immigration to retirement to our economy to just the way we treat each other, the choices we're about to make now are going to decide how we handle these changes happening around us. The changes are happening with or without us. The president's message, Make America Great Again, is trying to get people to believe that you can just stop all of the changes that are happening. It doesn't work that way. The political, social, economic, technological changes beneath our feet are only getting faster. The question is, can we master those changes before they master us? And I believe we can. And the well-being of my generation depends on figuring out how we can. But again, what I see in our campaign and what I'm so thrilled to be building is a generational alliance to get those solutions in place before we lose the chance. And I'm asking Iowans and I'm asking everybody who cares about where our country is headed to join me on that path. And I hope I'll have a chance to see you more on the trail. Thanks so much. Thank you. Thank you. Wow. Oh, thanks. Thank you. Thank you. Thanks so much.
Say thank you so much for running this operation. I know you showed me all the cards and the questions that you had laid out, and there were literally hundreds of them, the entire dining room table, because we had a lot of questions and we had a lot of candidates, but there is no way that we could have pulled this off without you. So on behalf of AARP, thank you very much for a terrific week and just a real professional job in getting these candidates to answer the questions. Thank you very much. Now I'd like to turn it over to Carol. As I mentioned earlier, none of this would have been possible if Carol on the other line of that phone call had not said,